Good evening and welcome everyone. Welcome to Managing Medicine Side Effects, brought to you by Pharma Sentinel. Please let us know where you're dialing in from today by typing in the chat, and let us know what you do too. Pop your LinkedIn profile in the chat to connect with other attendees. Welcome everyone. I can see people coming in now. Thank you very much for joining. Good evening and welcome. It's Managing Medicine Side Effects, brought to you by Pharma Sentinel. And just to start the evening off, we'd like to run a poll. We might just wait a minute because we can still see people coming in now. So we've got quite a few people registered. And just to start off, we'd like to launch a poll. Do you or anyone you know take one or more medicines regularly? Great, we can see the votes coming in. Great. Okay, couple more seconds there. Do you or anyone you know take one or more medicines regularly? Okay, now I'm going to share the results. And we can see that 73% of people on the call know someone or take medicines regularly themselves. And that is the theme for this evening, managing medicine side effects. Okay, so moving on. This is our agenda for this evening. First, we'll be actually hearing an open from Rav Roberts, our CEO, and then the UK State of Play by Dr. Annabelle Painter, How Healthcare is Changing in the US by Dr. Bob Adams, Black Patients and Patient Support Groups with Brenda King Mbe, and Why It Matters for Investors with Rav Roberts. Before we go on, I'm just going to go through the ways to engage. So I can see some people have already discovered the chat. There are two ways you can engage today. Many of you have already discovered the chat function. We recommend you change the audience to say all panelists and attendees so you can interact with each other too. If you have a question for the panel, please put it in the Q&A box. We recommend you use the Q&A function because we'll not be checking the chat for questions. So questions in the Q&A. You should be able to like the questions that are your favorites. That makes sure we answer the questions that you want answered. Questions into Q&A, go in there and like your favorites, interact in the chat. This session is being recorded. Okay, and on to the introductions. Our first and final speaker this evening, the founder of Pharma Sentinel, has an executive MBA from the University of London and a Wharton Business School Business Analytics certified, Google Squared online graduate, and Google AdWords certified, with 17 years experience leading and delivering innovative digital strategy, including 6 years in San Francisco, and an additional 7 years in Accenture Management and Consulting and Capgemini. Welcome, Rav Roberts. Our second speaker is an NHS doctor working in medical tech and AI, passionate about creating innovative solutions to healthcare problems. Ranked in the top 2% of UK medical graduates in 2016. She studied medicine at the University of Oxford and graduated with a distinction. First class honours in natural sciences from the University of Cambridge, associate of the Faculty of Clinical Informatics and member of the RSM Digital Health Council. Welcome, Dr. Annabelle Painter. Our third speaker is a former Navy SEAL and has 35 years experience as a leader in medical systems to advise health system leaders how to simply and affordably improve physician performance and increase patient wellness and satisfaction. He's a best-selling author of Swords and Saints, A Doctor's Journey, and 6 Days of Impossible, Navy Hell Week, A Doctor Looks Back. Welcome, Robert Adams, MD. Our fourth speaker has a degree in statistics and mathematics and economics from University College London, a master's in management, science and operational research from Warwick Business School. She was a member of the European Economic and Social Committee, and for over 15 years, she's overseen the successful delivery of a youth development program within the UK, using volunteer mentors from multinational firms to support Black British pupils from the state school sector. She also chaired the Employment, Social Affairs and Citizenship section along with other bodies. Welcome, Brenda King Mbe. First, we'll be hearing from Dr. Annabelle, but before we do, I'd like to welcome Rav Roberts, CEO of Pharma Sentinel, to provide some context around why we're here.
Thank you so much, Vanessa. I'd like to have a very warm welcome to everyone for joining us on our official launch of Pharma Sentinel and our app Medsi, MEDSII, that's just launched, just about soft launched about a month ago on the App Store and Play Store. It's no more wading through treacle, going to different websites, different social media sites, or different blog posts to get the critical medicines and other safety information that you need, such as drug safety alerts, drug interaction news, clinical trial opportunities as well. I'd also like to say thank you to our esteemed panel, Dr. Annabelle Painter from the UK, Dr. Bob Adams from the US. The US is a critical market for us, as you'll be hearing, and Brenda King Mbe as well. We're working very closely with Brenda King on a critical component of our app, which is to engage with patient support charities that provide such a vital safety net for people, millions of people everywhere. But finally, Vanessa, I'd just like to say a real heartfelt thank you to all the healthcare professionals that have been working so hard and quite often with such sacrifice on keeping us safe during this very difficult year during the COVID-19 pandemic. Thank you from myself. I'm a diabetic diabetes sufferer, and my family suffer from other conditions, just like many of your family do as well. So we hope that we're reaching the end of this and that there's light at the end of the tunnel as we enter 2021. Thanks, Vanessa.
Thanks so much, Rav. Thank you. And now I'd like to welcome Dr. Annabelle Painter. Welcome, Dr. Annabelle.
Thanks, Vanessa. So thank you so much for having me on this panel. It's a real honor to be part of it.
It's great to see you. So Dr. Annabelle, why do you think there's a gap for the market for this product in the UK?
Well, so as you mentioned in your very kind introduction, I'm an NHS doctor, and at the moment I'm working in primary care, but I've actually worked for several years before that in hospital. And during that time, I've kind of come to realise that in the puzzle that is the healthcare system as it is, I think one piece that's missing is a clinically robust, user-friendly and up-to-date resource for patients to go to get information about medicines. I think without that, what we see is instead people going to less reliable sources of information that can be potentially misleading and lead to quite a lot of misunderstanding and misinformation. And also, I think that the scale of this problem is huge, really. I think aligned with the poll we did at the start of this webinar, we know that 50% of adults in the UK are taking some kind of prescription medication. 1 in 10 hospital admissions are due to some kind of drug error or adverse drug reaction. And between 1/3 and 1/2 of all medicines prescribed for long-term conditions in the UK aren't taken in the way that's advised. So, it's a really big problem. There's a huge unmet need, and I believe that Medsi could be a really significant solution to this problem.
Excellent, thank you. So what are the problems with the current way that patients are given information about their medication? Given what you've just said, what resources are patients using to get more information about medicines at the moment, for example?
Yeah, sure. So, I think there are 3 main ways that patients are getting information about medication at the moment. The first and most obvious one is that they get it from doctors. So, medications are generally started as part of a medical consultation. And I think it's worth just contextualizing that by saying, in the UK, certainly in primary care, we have 10-minute appointments. In secondary care, they can be a bit longer, but often about 15 to 20 minutes. And in those consultations, they aren't just about starting a medication. So in that time, the doctor might also be diagnosing a patient. They might be catching up with their progress after the last few months. They might be examining them. And then they might also be starting a medication. So there simply isn't time in that slot to give that patient the detailed information that they might want or need about a new medication. But on top of that, I mean, even if they were to be really thorough and have lots of time to talk about the medication, we know that people generally only retain about 50% of what they hear in a consultation. So even with the best will in the world, you know, people aren't going to take away a huge level of detail from a consultation with a doctor. So given that's the case, where do they go to next? Well, another obvious place is medicines information leaflets. So any drug packet will come with some written information directed at patients, which they can read. I think there are a couple of problems with that format. The first is that, you know, the information is written in quite a dense way, quite a lot of medical terminology. And to me, it feels more like the terms and conditions at the end of a contract rather than it being designed in a truly kind of user-friendly, easy to read, easily digestible way. The other thing is that the writing is very small and it's very difficult to read for anyone with any kind of visual impairment, which, you know, is significant when you think that it's older people who tend to take more medication, and it's also older people who have more likely to have deteriorating vision. And lastly, it's not dynamic. So if there's any new update that comes about that medication, some new information, the patient's not going to get that from that information leaflet. So if patients aren't getting information from their doctor and they're not getting what they need from the information leaflet, I don't think it will come as a surprise to anyone to hear that where we often see patients going is to Google to get information. And, you know, the internet has got a lot of amazing resources and really good quality information, but it also has a lot of misleading information and pseudoscience. And, you know, as a layperson, it's really hard to know what isn't reliable information. So, for example, if we take social media as an example, we know that health misinformation was viewed 3.8 billion times last year, and that's been especially bad during COVID. And that's why I think we need a resource to send people to that can be relied upon to be accurate.
So important, thank you. So how do you think having patients that use Medsi will change the medical practice?
So I think, for me, the best way to think about this is that as doctors, what we're aspiring towards is having what we call joint decision making. So it's when we can make a decision together with our patients that best suits them, their needs, their lifestyle, and helps with their symptoms. And in order to have that kind of joint decision making in an effective way, the best way to do that is to have patients who are empowered with the right information about their condition, about their choices, and about, you know, their medication that they're taking. So at the moment, we spend a fair amount of the consultation itself trying to do that empowering and educate patients and give them the information they need. And also, following from what I was saying earlier, we do spend a fair amount of time debunking things that people may have heard or read online that maybe aren't accurate. And then, you know, at the end of that consultation, where you spent a lot of time trying to give people information to then ask them to make an immediate decision, you know, it's difficult for patients to digest that and make a decision immediately. And it's just not the best way of achieving that kind of joint decision making. So I think what would be much more effective is if we could give people a resource and say, go away, have a look at this, get the information you need, so that they can become empowered, they know that the information they're reading is reliable, and they can come back to a consultation with us where we can have that really powerful conversation and allow patients to make the best possible and well-informed decisions about their ongoing care.
Thank you. I can see why that's an attractive prospect. And how do you see this app fitting into the medical model of the future? So how can doctors and healthcare professionals get involved?
So in terms of fitting into the medical model, I think a great way is a bit like as I was describing then, it's, you know, in a situation in which you want to potentially start a patient on a new medication, at that point directing them towards MedC and saying, you know, here, go and have some information, come back and we can have a conversation. So at that point, I think that's when it would be really a valuable point to fit it in. But I think there's also a lot more potential for this going forward. So once a patient is started on a medication, I think they can use MedC to report any side effects they're having directly to the app. I think, you know, we're also looking to incorporate some AI into MedC that will allow patients to have more personalised information that's more specific to them and their needs. And I think longer term, it could be a really powerful tool for clinicians as well, in terms of giving us better information to make our clinical decisions. So potentially working out what could be the best medication for a given patient, but also working out if a patient comes to us with a given symptom, how likely is it that that's because of the medication they're on or because of the interactions with the medication they're on. So I think, you know, in the future, it could be a really valuable tool for both patients and clinicians.
It's really exciting news. Thanks so much for your insights and painting the picture of the state of UK. Thank you, Annabelle. Now I'd like to welcome Dr. Robert Adams from the US. Welcome, Dr. Robert.
Well, thank you, sir, and ma'am, and hello from the colonies. I'm pleased to be part of this august gathering.
Yes, my pleasure. Thank you. So, Dr. Bob, could you set the scene for us in the US, please?
Oh, gosh, yes. We had some earlier conversations about the difference between the various managed care systems in the United States and in Great Britain and other countries, Canada, north of us. But the biggest difference is we have 25 million uninsured patients, and that represents about 10% of our population. And that's a difficult challenge that our current president and our next president are going to have to deal with and are dealing with. But you know, we have a 25 million patient uninsured in the ages of 19 to 64 because we have an insurance program that protects our youth called Medicaid and the poor and the pregnant. And we have an insurance program called Medicare, which helps to protect our elderly. But none of those are free. They still come with costs because the biggest difference in the United States is we are a for-profit operation here. And we spend more money on healthcare than anybody else. And we don't do that much better a job than anybody else. So it's frustrating for me. There's a subset of our population that I come from, which is the United States military across all services. 5% of our patients in the United States are covered by the military healthcare system. And it's robust and wonderfully capable, but can cover such a small piece of the pie. So we're facing difficulties in access, not just because of COVID, but because of money. If you don't have the ability to pay for a doctor's visit, you don't come. And my greatest frustration as a family physician was exactly that. Patients would say, I'm sorry I didn't come see you for my medication refills or my diabetes check, but I couldn't afford it.
Thanks so much for setting the scene. So really different from the UK. Yeah, that was really clear. So what are the most common reason patients come to you? And could you share a personal story about the issue?
Yeah, I asked you to ask me that question because I try to teach my residents and my medical students this very important fact. As a family physician, I see pediatrics, obstetrics, geriatrics across the board. And that means I see just about every diagnosis and presenting problem there is. But if I had to pick the number one, it's not hypertension, it's not diabetes, it's the side effects of medicines. They're calling me about their side effects. They're worried about their children's symptoms. They don't know what the proper dosages are. And so medication management is a big, big, big part of my life. And, you know, the personal story that I shared with you earlier was I and my wife, who's not a medical professional, read this column in the newspaper. I read it today. It was fascinating. And this is one from last week, where patients who can't access their doctor are writing to a pharmacist and saying, help me understand what's going on here. And I brought this one because it really shocked me. The story is a woman whose husband was went to his physician for a heart arrhythmia and was given an antiarrhythmic drug that unfortunately caused permanent lung damage. And the response of the pharmacist is, gee, that's unfortunate. That shouldn't have happened. And in fact, it shouldn't have happened. The drug choice was an inappropriate one. And anything that we can do to help improve communication between drug manufacturers, providers, and the patient is going to be a positive effect on the increasingly remote care environment we find ourselves in now.
Thank you. That really starts to paint the picture of the difference that an app like MedC can make. So how has COVID-19 affected patients' ability to access care, do you think?
Well, that's huge. It's monumental, and it's overwhelming to the doctors around the world right now that patients are afraid to come to their doctors. They're afraid to go to the hospitals. They view now what used to be a place of warmth and care as a place of cold, sterile, germ environments. And what we're seeing in the United States is people are delaying their need for care to wait to see if they really have to go to the emergency room. And so when they show up, they're in crisis. So it's affecting a doctor's ability to give adequate care. And as Annabelle said earlier, we all have limited time with our patients. Our patients have a hard time accessing it. When you add the fear of calling or going, you compound that problem. So COVID has impacted, even in my own staff level, what my nurses and doctors are wearing masks. We can't communicate. You can't see our smile or our frown. It has multiple factors that affect the patient's access to care, and it's having negative effects across the board.
Okay, so how can Pharma Sentinel help, and what can patients do to access this information?
Well, I'll give you an interesting answer to that with a personal experience. Yesterday, I got a phone call saying, "Hi, this is your doctor's office. Are you ready for your annual Medicare physical?" And I went, "What?" And I said, "Well, is that in person?" "Well, your choice. Do you want it by phone? Do you want it?" I said, "I think I'll do it remotely," because there's where the positive changes of applications like the MedC app that you can download for free, and you can talk to the manufacturers, and you can let them know when there's problems, and you can get push forward information, is going to add to the need for remote care by physicians, nurses, pharmacists. The entire environment has permanently changed. We'll never go back to the way it was, in my humble opinion. And the need of developing effective remote monitoring systems is out there.
Thank you. So how and why can and should Pharma get involved?
So when you say Pharma, I apply two things to that. Pharma Sentinel, we're involved. We're helping patients communicate directly with manufacturers. And imagine, if you will, all 28 manufacturers of the current COVID vaccines suddenly have the ability to hear from their patients directly about side effects. That could affect the safety of what's coming down the line. It certainly is going to help the safety of our patients. And I expect, a rapid expansion of this application in the United States as the insurance companies discover it actually saves them money. Patients will be aware of what is dangerous. They'll address it more aggressively, more interactively. And in light of the difficulty of access, this is just a piece of what I call remote patient monitoring that is necessary and essential. So, really, I put a comment in the chat box earlier, welcome to the future. I think that's what this app brings to the medical environment today.
Thanks so much. So the future is bright. Thank you again, Dr. Bob, for sharing your insights in such an engaging way. And now I'd like to welcome Brenda King Mbe.
Hello, good afternoon. Okay, I should say hello because it's quite global. Hello, everyone. Pleasure to be here.
Thank you, Brenda. So, Brenda, regarding the relevance for Black patients and patient support groups of digital side effect reporting, what is the gap in the UK between medication and side effects information for these groups specifically?
Now, I'm the reason why I'm involved is that I see a great opportunity for this app to be inclusive. Now, this has been quite a challenging year for a number of reasons. COVID, we all know about, but we also know about the Black Lives Matter movement and the spotlight that has been shown in the the race disparity of outcomes when it comes to COVID and health outcomes in general. So I think this app, which Rav has said earlier, is free to download, so it is accessible, gives an opportunity for patients and patient support groups to manage their healthcare. I like, Annabelle mentioned about, being involved in joint decision making. So this is a trusted information source where you can gather more information so that you can have quite a targeted and meaningful conversation with your care provider, your doctor.
Excellent. Inclusivity can't be underrated, in my opinion, as well. So what's the relevance for Black and minority ethnic patients of digital side effect reporting?
Well, we don't have that information yet, but what we do know that in the UK and the US, what they do have in common is that Black patients have worse outcomes than the general population. So in the UK, there was some research done recently, and 60% of Black people said that they don't believe that their health is protected similar to white people. And when it was split by gender, this was 78% women who felt this versus 47% of males. And then the other thing that came out of this research, which was just launched a couple of weeks ago, is that Black women are 5 times more likely to die in childcare, while giving birth than white women. I mean, that is quite a shocking statistic. And what's even more shocking is that while the NHS acknowledges and regrets that this has happened, there's no target to reduce this, even though they have had this information since 2013. Now, I went through patient support groups that deal with pregnancy and birth, and looking that up, there are 23 patient support groups. And looking at that, going through the website of those groups, there's no mention of, they don't highlight things that Black, potential mothers, pregnant women, probably need to be aware of. And so I think there's an opportunity for patient support groups with this app, as well as Black patients.
Thank you. I was astounded by that statistic when you first told me. So yeah, I think everybody, we don't know about it, but it's.
But if you remember, one of the early victims of COVID in the UK was the nurse, the pregnant nurse, who died, at the hospital where she works while giving birth. So what is shocking to learn now is that her experience is not that unusual.
It's shocking.
Yeah.
What is the added value of the app for members of patient support groups?
I think the added value for the app, patient support groups, they tend to be, they don't tend to have all the resources they need. And as Dr. Annabelle said, that one of the difficulties that we have with side effect information, it may not be up to date. I mean, the wonderful thing about science is that they're finding new things all the time. So you get, they can easily access the latest information, have it on their website. They can have their details on this app so they can recruit more members, as well as having access to the latest information. And I also think there's an opportunity for them, if they're more inclusive and diverse, to increase their membership of Black patients who may be suffering from whatever medical, whatever medical problem that patient support group is addressing.
Okay. And so what are the options for patient support groups if they want to get involved? How can they get involved? What does it look like? How would it work in practice?
Well, one of the things they could do is to make contact. And I see Rav has put up the email address in which they can make contact, so that we can have a discussion on how could the app, as well as the patient support group, whichever one it is, can mutually benefit from some sort of cooperation together.
Excellent. Thank you so much for sharing your insights, Brenda King Mbe. And now I'd like to welcome Rav Roberts, founder of Pharma Sentinel.
Thank you, Vanessa. Can you hear me clearly?
Yes.
Now, yes.
Yeah, now, yes, great. So, yeah, very sorry. I think I had some audio problems earlier. But just to reiterate, Medzi, we're a one-stop shop for the best, the most trusted health, medicines and medical conditions information that we deliver to you in a very engaging Twitter-style interface that you can personalize to follow different medicines, conditions, such as women's health, men's health, children's health, and tailor to your needs. We're unique in that aspect. And as I said, we've had over 10,000 downloads. And in fact, going back to Brenda and caring for Black and minority ethnic people, we've had tremendous uptake in Africa, most of the countries in Africa, most of the countries in South America, and across Asia as well, and of course Europe and North America. So we're just thrilled, and we do think, as you said, Brenda, we do need to do more for ethnic minorities in terms of the quality of the health information.
Thank you, Rav. And so why should investors get involved in you and the app?
Right, well, there are a number of reasons why they should get involved. Number one is our mission is to help people lead a safer life. So it's a very noble mission, and if you believe in that, and we are, as I said, we've got great traction already, and this is our formal launch. So we expect that to accelerate into the end of this year and as we start the new year as well. We also have a stellar experienced team of founders. So other than myself, we've got our Chief Scientific Officer, Nasser, who's worked as a pharmacist for over 25 years at the medicines regulator in the UK and represented them in Europe. We've got Paolo, our CTO, and I've known Paolo and Nasser for 16 years almost. We met during our executive MBAs at Cas Business School, University of London. So we work really well together. Of course, our fantastic advisors as well, guiding us in the right direction. But other than that, we are looking to solve a global problem. It's not just in the UK. We're looking to absolutely launch in many other countries, and I'll be talking about that hopefully later. And we're not just a consumer focus. We are developing a B2B capability, software as a service license model that we will be looking to deploy at the end of Q2, beginning of Q3 2021.
Exciting news. And we've just heard from Brenda King Mbe, amazingly experienced, but what is Medzi and Pharma Sentinel's contribution to social impact?
Great question. And I'm very happy to announce that we were just accepted on to the London ALIA Impact Accelerator Autumn Cohort. And I know that Andrew Brisbane, who's running that, is here. Thank you, Andrew. This accelerator looks to heighten the impact that companies like ours can have amongst people everywhere. And if you think, we're looking to help people who take medicines and quite often suffer from very debilitating conditions. I think you've already heard that it's about 47% of the UK, 29 million people, about half of the USA, and globally, 1/3 of people in the world suffer from 2 or more chronic conditions and do not have quality information that they can turn to. That's why we're getting the traction that we are. We're not just solving one country's problem. This is global quality and trusted, the best information. We'll also be giving 10% of our profits to patient support charities as chosen by our users when they register. And so if any of your charities want to be listed in our app as something that a user can choose to donate our profits to, please do get in touch. And finally, all our information on developing world conditions, such as malaria, tuberculosis, and AIDS, will always be free of charge. And whilst, of course, much of the developing world do not have smartphones, the carers that look after them do. And also, we know that a lot of the developing world turn to mobile first, and we'll be there to help them, not just with our apps on the App Store and Play Store, which are already free, but with the web app that we'll soon be launching in a couple of weeks' time.
Very exciting. And as we saw on the call today, England, one of the wealthiest nations in the world, 73% of people on this call either know someone or take medicines regularly. So
exactly. Yeah.
And just moving on to the state of investment. So what is the current state of investment? What stage are you at? What are your future product plans and growth and scale plans?
Yeah, thanks, Vanessa. So we started raising about 3 months ago. We launched the company last month, and I'm pleased to let everyone know that we've already raised over £160,000 in pre-seed, just over $200,000. And we've got a few more investor meetings planned in the next few days and weeks. So we expect that to go up. And this includes international investors. We've got investors from San Francisco, New York, the UK, of course, and in the UK, the investors here have extra advantage because we are what is known as EIS, or the Enterprise Investment Scheme Advanced Assurance, approved by HMRC, which means that the investors here get an extra tax benefit. Essentially, they get around 30% of their investment back from HMRC almost immediately. So as far as our seed round is concerned, the next round of financing, we're looking to raise £800,000 at the end of Q1, Q2 2021, and that will give us 12 to 18 months runway as we develop our products. And what are we looking to do? Well, we've got Dr. Bob here. So the USA, launching in the USA, getting the USA medicines data, 20 odd thousand medicines and drug interaction data into our database so we can serve the American market. And we heard how difficult that is for people that do suffer from conditions. It's very costly over there. So launching in the USA is one of our key priorities next year. We're also looking to develop our B2B capability. So our data as a service, or software as a service data license model, we'll be launching that next year. And we'll be launching a subscription model in our app, which is targeted at consumers. We'll be having very high quality, detailed, more scientific data in our app for users. So a number of priorities that we'll be working on in the next few months and over 2021 as well. How can investors get involved? Well, please do email me directly if you're interested in discussing this further. I think we've got a couple of our investors already on the call, and I completely forgot to mention that we've already also got investors from Italy and Dubai as well. So please email me directly, rav@pharmasentinel.com.
Congratulations, but lots of work to do still. So what does the app look like? I'm just going to share the screen so people can see what it looks like. Rav, do you want to comment on look and feel?
Yeah, absolutely. So you can see there, this is our MVP. We launched last month. So it's still in development. We're shipping new code every week. So we're shipping new code every week. And you can see our app as it looks right now. It's a Twitter-style interface. You can save, share, follow different medicines and medical conditions, and and it constantly updates throughout the day. And at the bottom there, you can see, if you wish, you can actually look up your medicines and choose specific conditions as well. And as well as that, you can make what are known as adverse drug reaction side effect reports in our app. If you experience a drug side effect, say, like I do, I take simvastatin. Sometimes in the past, I've drunk grapefruit juice, and that is a well-known reaction. In fact, I didn't know about that reaction until I started using our app. So all of this and more as we go into next year. We're going to have videos, podcasts. Dr. Bob is going to be appearing in that. Thanks, Dr. Bob. I think you're going to have a weekly Dr. Bob kind of agony aunt session where you respond to our users' queries. So a lot is going on, and as Brenda mentioned, we will be developing the capability to help different ethnic minorities as well, due to the targeting that we're able to do in our app.
Really exciting news. Thank you so much, Rav Roberts. Congratulations on the launch and all your successes so far. But yeah, lots of work to do. Investors should please get in touch. And so that concludes your talk. Now we'd like to go to the Q&A session. We do have a question here from Giselle Preto. Do you have any channel for special needs, the impact of medicines and side effects? Rav, I might go to you first and then the others if they want to comment.
Yes, this is a great question, and exactly where our app, I think, comes into its own. And that's because we can tailor the medicines and medical conditions news that we have to target special needs or parents with special needs. And in fact, one of the alerts that we had that we got a very good response to in our app, it's a live alert, and we got an email from one of the users, was about a clinical trial opportunity for parents of autistic children in London, given by City University. Now, this person said there's no way they'd have heard about that clinical trial. And this just shows you the ability that we have to give the right information to the people that need it at the right time. Because if they miss that clinical trial, who knows when they'll hear about it, another one.
Excellent, thank you. And I don't know if Dr. Annabelle or Dr. Robert or Brenda would like to comment on that same topic. Brenda, please.
Yes, I also wanted to add, I think this is why, inclusivity is very important. But the other benefit as well is because the app gives people, it's easily to access recording of any side effects. This, I think, will be very useful as well. So if there are people with special needs having adverse effects from any medication, and they, and this is gathered in the app, that information will be useful for a number of people.
Absolutely.
Thank you, Brenda.
And I might add something real quick, Vanessa. I mentioned in my earlier introduction that remote patient monitoring is becoming a big deal. And I'm working right now with a company in the United States called Medicor Health, and they're shipping cellular communication medical devices like scales and glucose monitors and pulse oximeters and blood pressure monitors so that the patients at home can electronically communicate with their healthcare systems, whether it's the doctor, the nurse, or the electronic medical record. And this tool that allows the patient to be part of that remote patient monitoring network is just a huge additional advantage that I think as a physician, I'm going to be pleased to see my patients using.
Excellent. Thank you for that contribution, Dr. Robert Adams. And Dr. Annabelle, would you like to talk about that a little bit?
Yeah, I think one thing I just like to add is a bit, as I was kind of mentioning earlier, about the current way that we give information about medication. It doesn't really often take into account people's different kind of educational level, their different needs. It's not super personalized to them. I think one thing that MedC has to offer is that it's intentionally written in a way that's very easy to understand for lay people, and also allows people to take in that information at their own pace. And so I think it gives people a way to have information in a way that's more tailored to them. And certainly in the future, we're moving more towards having more personalized information, and certainly can look into other ways of making information more accessible. So it's as accessible as possible to all users, regardless of any disabilities or any learning difficulties they might have.
Very useful. Thank you, everyone. I hope that answered your question. Giselle, thanks for your question. Keep your questions coming in. Okay, so another question from Giselle. Epilepsy is a common problem. She says, thank you, everyone. Capturing the patient journeys under the theme of prevention is better than cure and integrated healthcare, especially based on the lessons learned from SARS. Thank you, Giselle. I'd like to ask a question that was sent previously, if that's okay. What does this mean for medicines takers in America, and when will it actually launch in America? So Rav touched on it before, but I might go directly to Dr. Robert Adams for this one, please, first.
Well, and I'm an advisor and not an operator, and Rob has said next year is when we're expecting its arrival. I actually have been in conversation with major insurance companies like Blue Cross Blue Shield about the need for more aggressive non-doctor office care for their patients. And they're literally standing by to tell all 100 million patients that this app is available. And it saves money, it increases the quality of care, and in our pay for services environment, it's going to be welcome.
Excellent, thank you. And Rav, Dr. Annabelle, would you like to comment on this question about what will this mean for America?
Well, America, as Bob has said, it's a huge market. It spends the most money on healthcare per capita than any other country as well. For us, it's a key market to grow into, and we're very happy that we've got Dr. Bob working with us as we look to enter the US in both the B2C with our MedC app market and also the B2B market, where there are huge opportunities, as Dr. Bob has said, with health insurers and pharmaceutical companies, to name just two of many industry verticals that we look to be targeting.
Excellent, thank you, Dr. Robert and Rav. So another question that's been sent in previously, will the app have any COVID-19 information? Rav, might go to you first on this one and then to the panel.
Yes, thanks, Vanessa. Currently, we don't have any COVID-19 information, and that's because we actually needed official approval by the NHS to have that. Well, I'm very pleased to let you know and everyone else know that we've just got approval 2 days ago from the NHS to have COVID-19 information, news and alerts in our app. And so we will be looking to deploy that before Christmas. We're very happy to be doing that. And I know that they saw the value of us getting trusted information out to people in the UK and elsewhere, that frankly, people elsewhere really value the NHS and the information that it has. We did a survey in India, South Africa, and America, and all of these people said that surveyed, not all, but the vast majority said they really want some trusted information and they trust the NHS information. And with the infodemic of misleading and quite often false or fake news on social media, this is why our app is really helpful, and we're really happy that the NHS has agreed to that.
That's fantastic news. I think anyone who's encountered the NHS in a first-hand scenario just can't believe how good it is. I know that's from my personal perspective anyway. Dr. Annabelle, would you like to comment on the COVID-19 information in the app in Medc?
Yeah, sure. So, I definitely echo what Rav was saying about producing a reliable information source. I think, as I mentioned earlier, the amount of misinformation, medical misinformation online on social media has exploded with COVID. There's, so much out there, and it can be overwhelming, and it can be hard to know what to believe. And, I think recent polls have suggested that with the new vaccines, only about 50% of adults are saying that they would have it. And I think the more information we can have that gives people reliable information and the right information, keep them up to date about the vaccines, and as people start getting the vaccines, what the experience are of the vaccines, and have somewhere to go to get that information is so valuable, so that patients can remain educated, and rather than a spread of misinformation, we can have somewhere for people to go to get reliable information instead.
Excellent, thank you. Yes, it can become a bit of a rumour mill there. Yes, Rav, would you like to comment on?
No, that's fine, Vanessa. I actually wanted to comment on something else before we wrap up, so please go ahead.
Okay, Brenda, would you like to comment on COVID-19 in Medc app? You're on mute, Brenda. Thank you.
Sorry that I was on mute. I don't know if I could add anything more to what Rav and Dr. Annabelle has said. I mean, it is very important to have trusted information. So, and congratulations to Rav for getting that the approval from the NHS to be able to put that information out there. Thank you.
And I'll stick something in if I can, Vanessa.
Please do. Yeah.
I don't think we've emphasized enough the newness and the interesting ability that this app is designed to bring to the medical care environment. We are going to allow a patient to report directly to a manufacturer the fact that they're having side effects on a medication or a vaccine when it's fully operational. That just doesn't exist right now. In the United States, less than 5% of side effects are reported because the paperwork process is a pain in the butt. We don't want to do it. I don't want to do it. And so this allows the medication producers, manufacturers to have access to their patients. And that could produce a huge improvement in the quality and timeliness of the medical care we provide.
Really important. Thank you for that, Dr. Bob. I think we've got time for one more question, and we have a question here from Simon Barker. Welcome, Simon, and thank you so much for your question. Do you think Medc might help ease the pressure on A&E departments now and after COVID? I'd like to go to Dr. Annabelle first with this, please, and then to the panel.
Sure. So yeah, I've spent a fair amount of time working in A&E, and I definitely think that it has a role to play in helping to ease some pressure from A&E. I think, as I said earlier, we know that 10% of hospital admissions are due to adverse drug reactions, and most of those admissions are going through A&E. So if we can try and limit the number of adverse drug reactions by using Medc to inform patients and make no symptoms to look out for, I think that can help things. The other thing we know about A&E is that people use it as a resource to get medical advice when they can't otherwise get it. So when there's huge pressure on primary care and patients can't speak to GPs, they will go to A&E instead. And at least 50% of the attendees to A&E are what we call minors, and a lot of those are actually GP problems. And the reason the patients are in A&E is because they can't see anyone else that day. So if we can alleviate that workload by giving patients information about the medication, so if this is a problem they're attending A&E for that's related to medication in some way, then we can help relieve that pressure.
Thank you, Dr. Annabelle. And would anyone else like to comment on Simon's question? Do you think Medc might help ease the pressure on A&E departments now and after COVID? I'm up to the panel.
Yeah, hi Vanessa. I'd just like to follow up on what Bob said. So Bob has mentioned that he's already in discussions with Blue Cross Blue Shield, a major health insurer. One of the use cases they're looking into is that quite a few of the people that they insure do not take notice of the side effects that they're experiencing, just like over here. And unfortunately, this means sometimes they end up in A&E. We do think that if they can use the information in our app in the USA, that we could lower those numbers, and that can save the individuals, the people concerned. They can save their health, their money, and as well as the money for the health insurers, and as well enable the hospital to focus their efforts on more critical cases. So we really do see that our app can improve patient outcomes.
Excellent, excellent. Right, okay, it's 4 minutes to 6. I'd like to invite any closing comments from the panel and then hand over to Rav to close.
Brenda.
Sorry about that. My mute not well coordinated today. No, I think that it could have a positive impact on A&E. I mean, if you are taking some medication and you have a bad cold or you suffer from hay fever and you go to your pharmacist and you get some medication for something that's immediate. But I mean, I have to add, I think, as Dr. Annabelle said, it's easy to read, as Ralph had pointed out, easy to do a search. So you can quickly, you don't have to go through these reams of sheets of paper with the fine print to see where there may be negative interaction. So you can easily see it and, or do a little bit of research before you go to your pharmacy so that you can have that discussion. And so I think that this in the long run can have an impact. And I mentioned earlier, because I think there's a lot of research there that, when there's an a female, will go to her health service provider. For a male, he tends to, to delay because he thinks, oh, it might not be something important. But maybe if, they did a little bit of research with the app because it's easy to use, then they can decide, do I need to go to the doctor or if I do not? And I'll end there. Thank you.
Thank you very much, Brenda, for your thoughts on that topic. 2 minutes to go. I'd like to thank you and hand over to Rav Roberts to close.
Well, thanks, Vanessa. Thank you very much for hosting us. And also thank you, Dr. Barb, Annabelle, Dr. Annabelle Painter and Brenda King as well for being on our panel. But most of all, I'd like to thank our users of the app. And we've got one here called Alfred. Alfred's actually a trainee pharmacist in Ghana, and he got in touch. He accidentally discovered our app, and he got in touch from our app. And we didn't even think about that use case to start with. So thanks, Alfred, and thank you to all our users everywhere in the world.
Thank you, and thank you for joining. Thank you, Rav.
Yeah, thanks to all our attendees.
Thank you. Bye-bye. Have a lovely evening.
Bye-bye.